Hi, Shimizu. Thank you for sharing the screen. It's already 6:07 p.m. here in Nepal, and first of all, thank you every participant for joining. And Novil, most of them are in the middle of the exam, so we will record this video and we'll send this content to them for the tailored assignments. So we have a moderator, Bikash, here. Bikash, would you mind turning on your video? Hello? Hello, Bikash? Hello?
Yeah, having some issues with my laptop here.
Okay, sure.
Just a second.
Hi, everyone. How was your day? Give some reactions to Novil. So this is very special day for me, especially because Novil is attending this session from Sri Lanka, and he's my community engagement exchange mentor. He's someone who has constantly guided and monitored from the beginning of Hamra. But even before that, even before we had the name, we had the concept, he was there. So thank you, Novil, for making your time and for your dedication to be here. We're so excited for you here. And then I think in the middle of things going on through the Hamra Baini, in a couple of months, Novil will come to Nepal to meet you, everyone in person as well. So we are planning on that, working on that. So we just want to be hopeful for that as well. Having said that, I would like to welcome Bikash Dangal as the moderator for this session. He is Teach for Nepal alumni, and then he's also pursuing his master's in nonprofit MBA, is one of my classmates as well. So thank you, Bikash, for agreeing to be the moderator of this session. So over to you now, and good luck to both of you. Thank you.
Thank you, Prakriti. My background is quite noisy here. I guess, is it disturbing there?
No, it's good.
Okay, thank you. So, Prakriti already introduced me and a little. As she said, I'm studying together with them, and recently I'm working in public schools here in Kathmandu, and it's really good to be in this session, and I'm happy to have this opportunity to lead this session. Actually, this is my first time to know Dr. Novil, and it's really good to know about the good things he's doing, and we're having him here. Okay, so before that, let's start with our Amrabani vision and vision and all. Prakriti, would you mind sharing those slides, because I did. See here?
Bikash, I'm sharing the slides.
Oh, it's your slide, yeah. But before that, I would.
There's another slide. Okay, let me stop sharing.
Just a second. right now. Just give me a second.
Because
Yeah.
I think we can continue without the slides. Just let's get to the point. We can continue without the Hamrubaini slides, and we can just get into Novil's introduction and other parts of the session.
Okay, then it's okay. It's really annoying me that my laptop is not working properly right now. Yeah, so introduce Mr. Novil here. He's a medical officer and working in disaster management. He is consulting the Ministry of Disaster Preparedness and Response Division in Sri Lanka since 2014. And it's really good to see him previous session also. And especially in this session, he's going to talk about, actually we will have 3 different slides, and we will have a general idea on how the SRHR work in disaster, and then especially the role of SRHR during a disaster, especially for adolescent, and how to be like well prepared. He's learning and all observations, the thing he's working in different phases. Those he will be covering here. And it's really good to have him here. And yeah, without being late, we are already late. So let's welcome him here. Mr. Novil, please, you can start sharing your slides, and looking forward to know more. Thank you.
Thank you. Thank you so much, Bikash. Thank you so much for the opportunity. Thank you, Prakriti and Hamro Bagini. And also now they are called United for Impact. What a name. And what evolution. So precious experience for me. Thank you so much for giving this opportunity. So before we start today's session, I want to know, what is your favorite food and what is your favorite disaster? If you could type it in the chat. I know it's odd to call disasters favorite, but maybe the disaster that you have worked with, or disasters that you have experienced in, or maybe disaster that you are afraid of. Can you write that in the chat box, your favorite food and your favorite disaster? I will write mine, okay? Then you all can write it in the chat. So just type it in the chat because we don't have much time. Otherwise, I would love to listen to you, but I will write mine, my favorite food and favorite disaster. Can you write yours? Food, biryani, and earthquake gives me anxiety attacks. Yes, thanks, Prakriti. Thank you so much. Do you have vegetable biryani in Nepal? I'm sure you have, right? Great. Anybody else? What about the other? Momo. I love momos. I love momos. One reason I want to come to Nepal is eat momos. Okay. Momo. There's so many Momo fans. Earthquake, chicken chili. Okay. My favorite food is tukpa. What is tukpa? Tukpa. What is tukpa? You could write it in the chat. Sandwich and disaster, landslide, earthquake, favorite food, landslide, chicken curry, momo, takalikana set. What is takalikana set? You can explain to me in the chat, okay? Takali. In Sri Lanka, takali means tomatoes.
Actually, that's takali.
Yes.
Takali means tomato?
Yes.
Oh.
What do you call takali is tomato? What do you call it? It's different. Okay, great. So let's go down. Momo earthquake. Okay, great. I would love to spend most time on food, but let's do that when I hopefully get a chance to come. Okay. Pasta is great. Fear is tsunami. Tsunami is one of your biggest fears. Yeah. Yes. By the way, I want to introduce you to Damitri from Sri Lanka, who is joining this session to observe. Yes, so you fortunately are in Nepal and you all don't have tsunami. But we are in the middle of the Indian Ocean, so we have tsunamis, right? Okay, great. Right, with that, so we have so much diversity in our food, right? We have so many things that we like to eat. And of course, disasters are things that we don't like, right? Whatever the disaster, tsunami to earthquake, landslide to nuclear disasters, to chemical accidents, to road traffic accidents, you name it, they are all around us. They're so common, right? Disasters are common. As much as our food, every day, if you put your TV on, you will hear about some kind of disaster somewhere in the world. And even in your own country, if you look at your own country news or newspaper, you will find disasters. So disasters are there to be with us. So today's topic is not necessarily about disasters, but it's a little bit related to disasters. So we are going to talk about sexual and reproductive health in emergencies. You know what an emergency is? Where there are so many natural hazards in the environment, such as mountains, rivers, ocean, but they are not causing any problems. But suddenly they can create emergencies. For example, if there's a early warning for tsunami, people have to evacuate, and that is an emergency situation. But if people don't evacuate, it can go into a disaster. Right. For example, take the Turkish and Syrian earthquake. That is a big disaster. So today we are going to talk about how sexual and reproductive health is important in emergencies. You might find that these are two very distantly connected topics, but the truth is that these are very closely related to each other, and let's do that through brief presentations and very interesting activity today. So these are our learning objectives. The first objective is to explain why it is important to address sexual and reproductive health in emergencies. Why we have to talk about sexual and reproductive health? The second objective is to define key terminology and concepts for sexual and reproductive health in humanitarian settings. We will learn some key terminology and concepts. So you might know some of these concepts and terminologies. So we will revise them, review them, and maybe learn some new concepts as well. finally demonstrate skills in advocating for the inclusion of sexual and reproductive health in emergency preparedness and response. So you all are Hamro Bagini champions. You are leaders in your community. So you have so much power. And also, you are healthcare professionals. You are going to be healthcare leaders in future. So you have the power to advocate for sexual and reproductive health in emergency preparedness and response beyond your house, beyond your community, beyond your health institution, and sometimes beyond your country. So these are the three objectives that we are interested in sensitizing you today during this training program. If you take globally, we are in the middle of humanitarian crisis. About 34,000 people are forcibly displaced each year. 34,000 people are displaced each day, every day when you wake up and when you go to sleep during that 24-hour period. Around 34,000 people are forcibly displaced. That means they have to leave their house. They don't want to do so, either due to disasters or due to conflict. In the world, 68.5 million people are forcibly displaced per year. Out of that, 40 million people are internally displaced, while 25.4 million are refugees, and 3.1 million people are asylum seekers. What are these? These are slightly different terminologies. First of all, let's look at internally displaced people. Internally displaced people are displaced within their own country. For example, if a tsunami occurs in the coastal areas, people will be shifted or displaced from those areas to inland areas. After the earthquake in Nepal, people from hilly areas, maybe they were displaced into safer areas close by. So those kind of people who are displaced, but they're still inside their own houses, their own country, they are called internally displaced people. But when somebody crosses a country boundary, they cross from one country to another country, then they become refugees. And asylum seekers are people who have to flee their country because their life is not safe there. So if you feel that you will be killed in your country, or you will be subjected to violence, or you'd be subjected to torture, then that person can go and ask from another country, look, my life is not safe at home in my country. Can you please save my life? So all the countries, as the members of the United Nations, cannot say no. So they are bound to say, okay, your life is in danger, human life is precious, therefore they can grant asylum. So those are the three types of people that have been displaced in the world: internally displaced people, refugees, and asylum seekers. So here is a map of our region. You can see Sri Lanka. You can't see Sri Lanka because it has been covered by this one. We are just here. Okay, so here the 2004 Indian Ocean. Then we have the Nepal earthquake here, and so many other disasters in the region. So we are living in a disaster-prone area. Our region, Southeast Asia or the SAARC region, is full of disasters. We are highly populated region, But in the meantime, we are full of disasters. You name it, we have it. We have floods, we have landslides, we have cyclones, we have tsunamis, we have floods, right? We probably don't have any snowstorms, or maybe some kind of heavy snowfalls in countries like yours, for example, right? We don't have snow in Sri Lanka, but in your country, probably in mountainous areas, there might be some snowstorms as well. So we are a region full of disaster. That is why we have to be ready and we have to be prepared. Now, I went and did some research about your beautiful country, Nepal. There are so many things so interesting about Nepal, starting off from the most venerated and most prayed person in Sri Lanka. Most venerated person in Sri Lanka is a Nepalese. As I always tell Prakriti, so Lord Buddha has been born in Nepal, right? And at your beautiful airport, you have a board telling welcome to the country of Buddha, or the country where Buddha was born, right? So we have so many things interesting, and we are so eager to learn more about those. However, if you look at the natural disasters in Nepal by 2022, earthquake has the highest risk, then flood risk is there, epidemics like COVID-19, drought, and tropical cyclone. So you can see tropical cyclone risk is quite low, but when you take earthquake, the risk is quite high. So if you want to find more information about risk, you can go to this Statistica web page and you can download those information. So we are now clear that we are in the middle of a global humanitarian crisis. And now, how can we, why do we have this global humanitarian crisis? Firstly, as we just discussed, we have natural disasters. Then we have climate change. So we always talk about Himalayas mountains. And so Himalayan mountains, there's ice caps being melted, right? So likewise, in our countries, in Maldives, the sea level is rising, right? So in some countries, we are experiencing extreme weather. So climate change is a reality, and it has come to stay with us. Of course, we have armed conflict. Sri Lanka, we have a history of armed conflict. We had 30-year-old war, which came to an end in 2019 or 2009, fortunately. And then political repression. This is a common theme that is found in our region. Complex emergencies. Sometimes they're not wars. Wars are usually fought between two countries. It's according to international laws. But complex emergencies are very different. You have two extremist group and army. Or it may be some kind of a terrorist group and army. It may be insurgent group and army. Or it might be two insurgent groups, or it might be two extremist groups. So those kind of things are called complex emergencies, because it is so hard to find out who the enemy is. Then we have epidemics. So we all are from the generation of COVID-19. We remember the lockdowns, we see how many people died and the challenges we had. And now we are going through another pandemic, that is epidemic or public health emergency of international concern, which is monkeypox. And then we just finished Zika virus before COVID-19, and also we had Ebola virus, and even recently we had some Ebola virus outbreaks in the South, in the African subcontinent. Technological hazards like fire, chemical explosions, nuclear events, those are also not forgiving us. They're coming after us, chasing us, right? So we may have a combination of the above. So these are some of the causes of global humanitarian crisis. The truth is that global humanitarian crises do exist. What is a disaster? Disaster has come from the word dis means bad. Aster comes from the word star. So in those days, people did not have newspapers, they didn't have predictive models and all that. So they looked at the sky, and when a bad disaster happened, they always saw some kind of an odd star. Therefore, they thought that the disaster came because of the odd star. So it is a serious disruption of the functioning of a society involving widespread human, material, economic, or environmental losses and impacts, which exceeds the ability of the affected society to cope using its own resources. So disaster is always a bad thing. Right? It's not a good thing. But the hallmark feature of a disaster is the exceedance of the ability of the affected society to cope using its own resources. So you have an event, and due to this event, the capacity of the society is exceeded. They cannot cope anymore. They need external assistance. And that is the hallmark of disasters. So if you want to learn this definition and more definitions of disasters, as well as other important concepts, please visit UNDRR. What is UNDRR? It is United Nations Office for Disaster Risk Reduction. So what are the effects of disasters? Disasters have various effects on the affected populations. They can become refugees, they can become internally displaced persons, and also they can have effects on the host communities. Who are the host communities? Host communities are the people who live in that area. But due to the disaster, some other group of people are coming to that area. Those people can either be refugees or internally displaced persons. Affected populations who remain internally stuck are called but sometimes some people are internally stuck. So the host community is the place where relatively good place, internally displaced people and refugees go to that area, but from disaster affected areas, some people cannot go up. For example, if you take the case of Nepal earthquake, people could not go to some affected areas for long periods of time, few days, right? So they were stuck in that area. So that kind of a situation refers to internally stuck people. So in summary, emergencies can have negative effects on communities. What are these negative effects? There can be affected population may be found in camp settings, temporary evacuation centers, transit shelters, or they might be transiting, they might be going out. Their own communities or homes, the homes of family or friends, neighboring communities, or urban or rural settings. So affected people can be anywhere. Irrespective of where they are, they might have a lot of health problems. And the effects of emergencies could be from multiple factors. We say this equation. Please remember this equation. When you have a little free time, go and search more about this equation. In summary, it says that risk is cumulative factor that is determined by hazard, vulnerability, exposure, and capacity. So hazard is the damaging nature of the event. For example, earthquake magnitude. A 4-point earthquake is less powerful than 9.4 earthquake. So there's more hazard in a 9.4 earthquake. Then vulnerability is the factors that determine the damage that factors that are negatively contributing to the disaster, that makes people vulnerable more, make people more susceptible. Those are called vulnerability. Exposure means the number of elements at risk. Capacity means the positive factors, positive attributes of a community that make them resistant and resilient to disasters. So, mechanisms for protection and service delivery, such as health, education, and police, are disrupted during disasters and emergencies. You would have experienced from the Nepal earthquake. And the community support systems and protection mechanisms also break down. However, sexual and reproductive health needs of communities continue. What is sexual and reproductive health? You know the definition of health, right? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, right? That definition you all know, right? Can I have a thumbs up if you know that it is correct? Yeah, everybody can remember. Maybe you have forgotten that, but probably it is a definition that we have all learned. And then when you add the content of in all matters related to the reproductive system and to its functions and processes, then it becomes sexual and reproductive health. So sexual and reproductive health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to reproductive health system and to its functions and processes. So when disasters like floods, landslides, and tsunamis occur, it can have effects on women and girls. Women and girls are at increased risk because rape and other forms of sexual violence could occur. Early child and forced marriages can occur. Human trafficking could increase. People will try to smuggle people from one country to the country or from one region to the other country. Due to many reasons, unintended pregnancies could happen. One reason is lack of contraceptives. People don't get access to contraceptives. As a result, there could be unintended pregnancies. Unsafe abortions could take place because people don't want babies. They had babies due to the unintended pregnancy, and now they want to terminate their pregnancy in unsafe situation. And complications during pregnancy and delivery. Babies are beautiful, they bring happiness, but when a mother goes through pregnancy and has to do a delivery, that involves certain amount of risk. And then sexually transmitted infections and HIV can increase during disasters and emergency. So though we say women and girls are at increased risk, men and boys are also at increased risk, right? Boys can also get abused in all these forms. Men are also getting abused during disasters and normal times. But relatively, the large number of people are from these groups. So that is why we say women and girls are at increased risk, but in reality, it is not only women and girls. The whole community is at risk for such events. And also, some groups are at higher risk for sexual and reproductive health issues. Adolescents, right? Young people like you all, or your friends, or your colleagues in the university, or your sisters, brothers. Adolescents are more vulnerable because they don't have access to knowledge, they have very limited access to resources, so they might have a lot of problems. And then, as you know, LGBTQIA groups. So up to now, we discuss about binary gender. We talk about two groups of people, male or female. But there are other groups. For example, if you talk about their gender, there can be people like transsexual people. So transsexual people, they will start as a male by birth, and they think that they are not male anymore, but they want to become a female. Or a person who is born as a female will decide that, or feels that I'm not female anymore, so I want to become a male. So that is transgender. And some people have intersex. Intersex is a group of rare conditions where people have remnants of both genitalia, male and female, that is intersex. Then people can be different with relation to their sexual orientation. To which gender or which group of people are you attracted to and sexually interested in? Sometimes it's only an attraction, but not go into a sexual encounter. Sometimes it could have both. So lesbian, we know it's about females who have sex with male or female who are attracted to females. Gay means males who are attracted to males. And then bisexual involves people who are interested in both sexes. And then queer is a group of people who are probably questioning about their sexual orientation. They're not very sure, probably. And then asexual means they don't have any sexual pleasure or sexual, they don't get interested in sex. So all these people, irrespective of their gender identity or their sexual orientation or preference, they are all human beings. So that is something that they are probably born with, probably socially determined, but irrespective of that, whatever their sexual orientation, they're human beings. So they have to be respected and their rights have to be protected. And another group that is vulnerable involve people living with disability. You know that. And people living with HIV. So these people will have more vulnerability for certain conditions. In the picture below is a displacement setting that I worked in. This is after the internal conflict on Sri Lanka. Large number of people were displaced to a place called Manik Farm, and I was involved in the team of people who were providing healthcare for these people. So this is the kind of tragic situation that people will have to be after disaster and emergency. And sexual and reproductive needs are still valid in this kind of a setting as well. Okay, so let's watch a small video now. Please let me know if you can hear the sounds. This is in Sinhalese, I'm sorry, but I think you will understand some words, and it has the English subtitles, right? Okay, let's watch that.
ආපද අවස්ථාවන් වලදී අවතැන් වූ ප්‍රජාවන් අතර ලිංගික හා ප්‍රජනක සෞඛ්‍ය සුරක්ෂිත කිරීම සඳහා අවම ආරම්භක සේවා පැකේජය පිළිබඳ වූ වීඩියෝවකි. ශ්‍රී ලංකාව නිරතුරුවම ස්වභාවික ආපදාවන්ට ලක්වන රටක්. එනම් ගංවතුර, නායෑම්, ටොනේඩෝ 2004 දී ප්‍රබල සුනාමි තත්ත්වයකටද මුහුණ දීමට සිදුවිය. එමෙන්ම වසර 30ක් පමණ පැවති යුද ගැටුම් නිසාද උතුරු නැගෙනහිර ප්‍රදේශවල ආපදා තත්ත්වයන් නිර්මාණය විය. මෙවැනි අවස්ථාවකදී බොහෝ පිරිසක් අවතැන් වූ පුද්ගලයන් බවට පත්වීම සිදුවේ. වාර්ෂිකව ලොව පුරා මෙලෙස අවතැන් වන පුද්ගලයින්ගෙන් 75%ක්ම කාන්තාවන්, දරුවන් හා යෞවනීන් බවට වාර්තා වන අතර ඔවුන්ට සිය පවුල හා සමීපතමයන් මගහැරීමට වැඩි ඉඩකඩක් පවතී. ඕනෑම අවස්ථාවක අවතැන් වන කාන්තාවන්ගෙන් 4%ක් ගර්භණී තත්ත්වයේ පසුවන අතර ඇයට ආපදාව සිදු වූ පරිසරයේදී හෝ අවතැන් වූවන් රැඳවූ ස්ථානයකදී හෝ රෝහලකට යන අතරතුරදී සිය දරු ප්‍රසූතියට මුහුණ දීමට ඉඩ ඇත. එමෙන්ම ඇයට සිය දරුවා ආරක්ෂිතව බිහි කිරීමට තරම් ප්‍රමාණවත් වෛද්‍ය පහසුකම් හා රැකවරණය නොතිබීමටද ඉඩ ඇති අතර එලෙස සිදුවන දරුවපත් වලින් 50%කටම ප්‍රථම පැය 24 තුළදී මවට හෝ දරුවාට ප්‍රබල සංකූලතා ඇතිවීමටද ඉඩ තිබේ. එසේ සිදුවන්නේ දරු උපත සිදුවන විට මව අධික පීඩාවට ලක්ව සිටීමත්, දරු උපත සිදුවන්නේ අනාරක්ෂිත අපිරිසිදු හා අවදානම් පරිසරයකදී වීමත් නිසායි. මව හා දරුවා යන දෙදෙනාම ආසාදනයන්ට ලක්වීමේ අවදානමක් පවතී. ආහාර, ජලය, හදිසි වෛද්‍ය ප්‍රතිකාර, ආරක්ෂාව හා ස්ත්‍රී පුරුෂ ලෙස වෙන් කළ වැසිකිලි නොතිබීම නිසා අවතැන් වූ අනිකුත් කාන්තාවන්ටත් කඳවුරකදී විවිධ දුෂ්කරතාවයන්ට මුහුණ දීමට සිදුවේ. පවුල් සංවිධාන ක්‍රම නොමැතිවීමෙන් අනවශ්‍ය ගැබ් ගැනීම්, අනාරක්ෂිත ගබ්සාවන්, මානසික පීඩනයද ඇතිවිය හැකියි. ආපදා අවස්ථාවකදී ගැහැණු දරුවන් පවුලෙන් වෙන්වීම නිසා ඔවුන්ට ලිංගික හිංසනයන් සිදුවීමේ අවධානමක් පවතී. එමෙන්ම දෙමාපිය රැකවරණය හා සනීපාරක්ෂක ද්‍රව්‍ය නොමැතිවීමෙන් මානසික කම්පනයන්ට පත්විය හැක. ඔවුන්ට සනීපාරක්ෂිත නොවන වටපිටාවක ජීවත්වීමට සිදුවීමත්, ආවරණය නොකළ ස්ථානවල නිදාගැනීමට සිදුවීමත්, පොදුවේ වැසිකිලි භාවිත කිරීමට සිදුවීමත් නිසා ඔවුන් තවදුරටත් අනාරක්ෂිත බවට පත්වේ. මේ නිසා කාන්තාවන් හා ගැහැණු දරුවන් ලිංගික අපයෝජනයන්ට ලක්වීමටත්, සෝරා කෑමට හා මානව කුට්ටනයට ගොදුරුවීමටත් අවධානමක් ඇත. ලිංගික හා ප්‍රජනක සෞඛ්‍ය සඳහා අවම ආරම්භක සේවා පැකේජය ක්‍රියාත්මක වීම මගින් මෙවැනි සිදුවීම් වැළැක්වීම සඳහා පෙර සූදානම හා අවශ්‍ය ද්‍රව්‍ය පූර්ව ස්ථානගත කර තැබීම සිදුවේ. ඒ සඳහා අවශ්‍ය සහයෝගය ලබා ගැනීමට අධිවාචනය, සම්බන්ධීකරණය හා ධාරිතා ඉහළ නැංවීමට පියවර ගත යුතුයි. අවදානම හඳුනා ගැනීම, ඖෂධ, සනීපාරක්ෂක කට්ටල හා වෛද්‍ය උපකරණ පූර්ව ස්ථානගත කර තැබීම හා නියමිත අවස්ථාවේ බෙදා හැරීම මෙයට ඇතුළත් වේ. ප්‍රසූතිය සඳහා සූදානම් වන ගර්භණී මවකට අවශ්‍ය වන සියලු භාණ්ඩ ඇතුළත් මාතෘ සනීපාරක්ෂක කට්ටලයක් ලබා දෙන අතර ඒ තුළ මව හා දරුවාට අවශ්‍ය සියලු දේ අඩංගු වේ. අවතැන් කඳවුරකදී හදිසි ප්‍රසූතියක් සිදු කිරීම සඳහා අවශ්‍ය හදිසි ප්‍රසව ප්‍රතිකාර කට්ටල පුහුණු සෞඛ්‍යකාර මණ්ඩලයන්ට ලබා දෙනු ඇත. අනිකුත් අවතැන් වූ පුද්ගලයින්ටද ඔවුන්ගේ අවශ්‍යතාවය පරිදි කොන්ඩම් හා පවුල් සැලසුම් ගිලින පෙති ලබා ගැනීමට පහසුකම් සැපේනු ඇත. සැලසුම් කළ අවතැන් කඳවුරක් තුළ ස්ත්‍රී පුරුෂ ලෙස වෙන් කළ වැසිකිලි පහසුකම් සපයනු ඇත. කාන්තාවන්ට හා ගැහැණු දරුවන්ට ලිංගික හිංසනයකින් තොරව ආරක්ෂිතව ජීවත් විය හැකි පරිසරයක් සකස් කරනු ඇත. ඔවුන්ට සනීපාරක්ෂක කට්ටලයක් ලබා දෙන අතර ඇඳුම් හා සනීපාරක්ෂක ද්‍රව්‍ය එහි අඩංගු වේ. ඇයට ආරක්ෂිතව ජලය හා ආහාර ලබා ගැනීමට හැකියාව ඇත. මෙම අවම ආරම්භක සේවා පැකේජය මගින් ආපදා අවස්ථාවකදී ලිංගික හා ප්‍රජනක සෞඛ්‍ය සේවා සැපයීම සම්බන්ධීකරණය සෞඛ්‍ය අමාත්‍යාංශය මගින් සිදු කරන අතර එයට අදාළ අනෙකුත් ආයතන හඳුනා ගනු ඇත. ලිංගික හිංසනය වැළැක්වීමට පියවර ගන්නා අතරම වින්දිතයන්ට අවශ්‍ය ලිංගික හා ප්‍රජනක සෞඛ්‍ය සේවා වෙත ආරක්ෂිතව යොමු කිරීම සිදුවනු ඇත. HIV හා අනිකුත් ලිංගාශ්‍රිත රෝග වළක්වා ගැනීමට අවශ්‍ය පියවර ගැනීමත්, අවශ්‍ය මූලික ප්‍රතිකාර ලබා දීමට පහසුකම් සැලසීමත් මගින් ඇතිවන මරණ සහ සංකූලතා අවම කරගනු ඇත. මාතෘ හා ළමා සෞඛ්‍ය සේවා සැපීම තුළින් මාතෘ හා නවජන්ම මරණ සහ සංකූලතා ඇතිවීම වළක්වනු ඇත. පවුල් සංවිධාන ක්‍රම ලබා ගැනීමට අවශ්‍ය පහසුකම් සැලසීම මගින් අනවශ්‍ය ගැබ් ගැනීම මෙන්ම අනාරක්ෂිත ගබ්සාවන් ඇතිවීම වළක්වනු ඇත. ආපදා අවස්ථාවකදී මූලික ලිංගික හා ප්‍රජනක සෞඛ්‍ය සේවාවන් සපයන අතර ආපදාව සමනය වීමත් සමගම එය පවතින ප්‍රාථමික සෞඛ්‍ය සේවාවන් තුළට ඇතුළත් කෙරෙනු ඇත.
Okay. So you watched in that video how in a disaster setting, sexual and reproductive health issues become important and what can be done about it. So the video talks about minimal initial services package or MISP for sexual and reproductive health. As healthcare professionals, it's important that you know this. It is a set of priority sexual and reproductive health activities to be implemented at the onset of a crisis, at the beginning of a crisis. It defines which SRH services are most important in saving lives at the onset of an emergency, and they are useful for the minimal initial response. So this is a fact sheet of minimal initial services package or MISP. You can have this and many more information if you visit the Interagency Working Group, the AWG, Interagency Working Group website, and it will talk about all these 6 MISP objectives and what you can do to prevent those things. And also you have the sphere standards. MISP is minimal initial service package has been acknowledged in the minimal initial, the sphere standards. Sphere standards is another very interesting resource that you can learn, use to read, and it is called sphereproject.org. If you go to sphereproject.org, you can learn more about the sphere standards. So this is the interagency working group website. So if you want to know more about sexual and reproductive health in emergency, this is the place to find them. So it has this amazing guidance manual. It's called Interagency Field Manual on Reproductive Health in Humanitarian Settings. I hope this will be useful for you during the assignment that would be given to you after the end of this program. So why, in summary, why we are worried about meeting sexual and reproductive health needs in emergencies? They prevent disease, prevent disability, and saves life. So sexual and reproductive health is a human right for all migrants, refugees, asylum seekers, and displaced persons should receive basic education and health services. So it is no excuse. There are no excuses. Everybody has the right, irrespective of whether they are immigrants, refugees, or asylum seekers, or displaced people. All people have a right to sexual and reproductive health. And it is a part of the sustainable development goals as well. So concluding thoughts, sexual and reproductive health needs continue and often increases in emergency situations. Addressing sexual and reproductive health needs in emergencies saves life. The MIS for SRH is a set of priority activities to be implemented at the onset of an emergency. The MIS for SRH is a global standard for response. And sexual and reproductive health is a human right for all, including those in emergency settings. Yeah. So thank you much for your attention. I think that brings us to the end of the forum for Bikash. If you want to get some questions on the chat or any announcements. Maybe we are running a little behind, but the other two presentations are quite brief. So I think we can still manage time. Bikash, you want to say anything?
Actually, it is more insightful. Like last time we discussed it in a brief, but this detailed information is more informative, and even I felt like there are too many things we need to focus on, especially while the disaster is there. We all focus on disaster, basic safety practice, but when we are focusing on that, we miss the thing, like which look small, but the effect of those things bigger in the future. It will pull that livelihood of those people will affect here as well. I conclude this presentation in that way. And if anybody else want to ask anything or any concern about this presentation, ask here in the chat, and I will happily address those concerns here. Any concern regarding this presentation, just write it in the chat box. I don't see any. Oh yeah, could you please raise your hand?
Namaste, sir. It was nice meeting you. I have a simple question that, as you have mentioned earlier, minimal initial service package for SRHR. And I have a question, is that service available only during the crisis time, or at any time we can access to those services? Thank you.
Great. Wonderful question. Wonderful question. And it really brings to this slide. I wanted to come to this slide at a later stage, but look at this. This answers your question. So this is the normal time, okay? Here is the normal time. Preparedness, we are providing services, sexual and reproductive services. Those are called comprehensive sexual and reproductive health services. It involves antenatal care, well-women clinic, screening for cervical cancer, screening for breast cancer, and all that, right? Including deliveries, postnatal care, and then looking into intranatal care, contraception, premarital counseling, adolescent sexuality education, comprehensive sexuality education. So all that things we are doing during the preparedness phase, normal times, no disaster, everything is peaceful. But this is the time when the devastating event, disaster happens. Okay, after that, what happens is we cannot afford to provide all these services. Just imagine the first day after this earthquake in Nepal. We can't go and conduct antenatal clinics. We cannot go and start sexuality education. We cannot go and conduct well-women clinics or well-men clinics, right? So we can't offer everything. So we filter out most important things and we deliver them. And this is called MISP, right? Minimal Initial Service Package. So then we slowly start getting the comprehensive services back. Here you have the comprehensive SRH services. So after the event also, slowly we continue the MISP and try to expand and build on the comprehensive services. And as a result, after some time, post-emergency phase is over, we will have durable solutions and we will go back to the preparedness phase. So to answer your very important and valuable question, these MISP objectives are relevant every time, right? But out of all the comprehensive SRH services, we pick some and offer them during the emergency phase. But soon as possible, we want to go back to the comprehensive SRH service. I hope I answered that question. Thank you. Thank you so much for the great question.
Thanks, sir.
Okay, Bikash, then we will go to the other two presentations.
Yeah, sure.
Any question? Yeah. Yeah. Somebody wanted to ask a question? Okay. Please keep your question till the next session. We will take out those questions again. Can I go, Bikash?
Yeah, it's okay. Let's move to another presentation now.
Great. Thank you. Okay. Then now we are going to do something that we have already discussed, but to some extent. So we will move on to this brief presentation on inclusion. So this is a very important topic, right? In your work that you are going to do today, as well as this whole Hamrobaini project. And also any projects that you are doing, we have to make sure that we are including people, but not excluding. Let's talk about inclusion a little bit. So inclusion means leaving no one behind. You heard this, right? In UN documents, it's a very nice, catchy tagline. Inclusion, leaving no one behind, right? You can't leave anybody behind. What does this mean? So in this small 10-slide presentation, which will take about 10 to 15 minutes, we will recognize the importance of inclusion in humanitarian settings. Understand that power, identity, ability, and choice intersect to determine both vulnerability and capacity. Thirdly, we will discuss and demonstrate, and you will be able to demonstrate an understanding of right-based service delivery, and key tools for inclusion in humanitarian emergencies. So these are the objectives of this basic brief presentation. What is inclusion and what is exclusion? In inclusion, we tend to normalize everything. Whatever the people's age, sex, gender, ethnicity, religion, sexual orientation, their economic status, where they come from, their caste, okay? None of those, all those things are normalized to make them equal as human beings. But what is exclusion? In exclusion, some people are marginalized. What do you mean by marginalized? You push those things to a margin, to a corner. So they are cornered. They are not allowed to come into the mainstream, the main table, the big room. They are in a small room, corner, edge of the society. And that is what you call marginalization. In inclusion, people are all powerful. They all have the ability to defend against disasters and emergencies, crisis, corruption, and oppression. They have the power to overcome them. Whereas when you become vulnerable, you become the target of all those things. You become oppressed. You become suppressed. You become marginalized. Okay, you become vulnerable. If you include people, they become privileged. Right? If everybody is included, everybody gets the privilege of benefiting from the social services, health services that are there. But on the other hand, if you exclude it, people are left behind. Can you remember our motto? What was the tagline that we were talking about at the beginning? Leaving no one behind. So when you remember inclusion, even in the exams, in school, if you are asked to write something about inclusion, you just write in big letters, leaving no one behind, right? So that will give you some marks, okay? But some more you have to write. But so by inclusion, we are making people more resourceful and capable. What are the criteria that makes people excluded or included? Context matters. People are commonly marginalized due to societal attitudes to gender, age, disability or ability, sexuality, ethnicity, and indigeneity. What is your age? What is your gender identity? Are you disabled? Are you married? Are you divorced? Are you single? What is your race? What is your ethnicity? What is your sexual orientation? What is your religion? Are you HIV positive? And other things, right? So based on these, human beings can be marginalized. So in the relationships, in the households, in communities, they will have less power, right? So all these factors can contribute to exclusion. But if they are empowered, it will go or contribute towards inclusion. Why are people included? Why are people excluded? Discrimination against women persists in every corner of the world, but the experience is shaped by interwoven factors that build upon and extend beyond the gender element. These factors include race, socioeconomic class, age, sexual orientation, disability, and more. So what it says is, nowhere in the society, in the whole world, women are treated equally as men. No, it's not happening. There's some kind of discrimination all over the world. In our part of the world, it's very obvious. But even if you go to the most liberal countries and countries with so much respect for human rights and resistance against discrimination, still you see some kind of discrimination, right, against women. But how people are experiencing that is determined by many factors. Those factors are beyond gender, right? Those factors are part of a wider social, cultural bag. So these factors include race, socioeconomic class, age, sexual orientation, disability, and many other factors. Intersectionality suggests that each one of us lives as in a web where different strands of power, identity, ability, and choice intersect to shape the conditions in which we live. So it's like a web. Do you have spiders in Nepal? Do you have spiders in Nepal? Yes? What do you call spiders in Nepali? Yes? Okay. Please write what do you call that. Makura. Makura. Is it correct? Makura. Okay. You know what do we call in Sri Lanka? Makulua. It's very similar. I think it comes from Sanskrit, right? Yeah. We call it Makulua. And it's Makura. Makura. I think it comes from the word Makara. What do you call dragon in Nepali? You know the dragon? What do you call the dragon? What is the word for dragon in Nepali? You know dragon? In China?
Dragon. Fire.
Yeah. What do you call that in Nepali?
I don't know the Nepali name.
You don't know the Nepal? Anybody knows the word for dragon? Okay, we call it Makara. We call it Makara. Makara.
Makara.
Okay. Yeah, Makara. Most of our words are similar because they have, I think, some words are shared coming from Sanskrit, right? So Sanskrit origin. So
we have Makura, not Kara, but Makura.
Yeah, Makura. Very similar because it's like a bug. So they started the word like that.
But Makura means spider in Nepali.
Yeah, we call it Makulua. Makulua. Okay. So now we know about the spider. Now we read this again. Intersectionality suggests that each one of us lives as in a web. We are like spiders. We are not alone. We can't do whatever we want. We also have our net. I mean, we are also tied by this net, where different stands of power, identity, ability, and choice intersect to shape the conditions in which we live. So power over, power to, power with, power within. So sometimes people have power over the others. You try to exert power over the other people. Sometimes you try to transfer power to others. I give some power to the other person so that the other person will be empowered. Sometimes we have to work with the other people and power with, you work with the others. And sometimes power within, you try to find out the power within that individual, that woman, that girl, that boy, that man, that organization, or that community. So effective humanitarian programming must recognize and analyze these intersecting factors. This will enable better understanding of who holds power and who is marginalized in a community, barriers these groups face in accessing services, increase opportunity for marginalized people to have a voice in decisions in crisis and beyond, and ensuring no further harm is caused. So exclusion can be dangerous, but on the other hand, inclusion in humanitarian programming is very powerful way to help people. So in the Spheres handbook that I strongly recommend you to download and keep it, it's like an ebook. You can have PDF copy free of charge. And it's a online book also, like you can just click on the chapter and they will take you to that particular chapter or page. It talks about 3 basic principles as absolute rights. Absolute rights mean there's no discussion, no negotiation, no conflicts. Every human being has this right. What are those rights? The right to live with dignity, the right to receive humanitarian assistance, and the right to protection and security. Whether you are single, male, married, lesbian, gay, Nepali, Sinhalese, Buddhist, Indian, from USA, disabled, whatever, if you're a human being, you have these rights. And there are 4 protection principles. What are those protection principles? Avoid exposing people to further harm as a result of actions. Ensure people's access to impartial assistance. Protect people from physical and psychological harm due to violence or coercion. And assist the rights, claims, access to remedies, and recovery from abuse. So we have to make sure that when you go to the community, when you try to do this project, or when you go to your communities, or when you see the people from the community in your hospitals or wherever you are, try to adhere to these, especially during disasters and emergencies. Nothing for us without it. So this is another thing. So if somebody wants you to write an answer, for an example, write a short note on inclusion, you can write 2 sentences and you are likely to get pass mark. What are those 2 sentences? The first sentence I already told you. Can you write it down in the chat box? What is the first sentence I told you? That you have to write. Leave no one behind, right? Leave no one behind is the first sentence that you have to write. You have to, yes, leave no one behind. And then this one. What is this one? We just said nothing for us without us, right? Nothing for us without us. That means you can't talk about disability without having a person of disabilities in the forum. You can't talk about LGBTQI rights without having people with those sexual orientations and desires or practices. You talk about very poor people and telling that we should make poor people included in our efforts. You have to get the poor people come and talk to us. You have to, they should be in our forum, our platform. Great. And then, yeah, so that is that. So probably Prakriti could give us a help in typing that in the chat. What is the next one? Nothing for us without us. So if you write a short note on inclusion, if you write leave no one behind and nothing for us without us, then probably the professor will say, okay, this person knows something and they might probably pass. Okay, these are the concluding sessions of this brief session. 1. Inclusion in humanitarian emergencies like floods, landslides, conflict is critical so that we leave no one behind. Leave no one behind. Then a number of tools are available to ensure the integration of an inclusion lens into planning for and responding to humanitarian emergencies. So there are a lot of tools. If you want to learn more, please refer the SPHERE standards and also interagency working group manual that I shared with you in the previous presentation. Then all communities have assets as well as needs, right? So we have to be respectful to that. All program managers should maintain this lens throughout this training and their work. Now, the organizers of this program, Hamrobahini or United for Impact, they should keep that when they are organizing this program. On the other hand, when you as Hamrobahini champions go out to the community and implement your community engagement or community immersion work, you have to keep in mind So if you want to talk about, do something for those most disadvantaged girls, get the most disadvantaged girls to come and work with you, to contribute, to share their ideas, be with you, right? Remember the phrase, nothing for us without us. Okay, so I think if to sum up this session, let's try to everybody shout out, leave no one behind, and nothing for us without us, right? So can you say that in Nepali? I'm getting so interested in learning Nepali today. Nothing for us without us. With nothing for us without us. Can you say these two in Nepali? How are you going to say that? Leave no one behind. Please shout out somebody. Yeah, typing it or Bikash, are you a good translator?
I'll try.
Okay, yeah. Who wants to go? Yeah, please.
So leaving no one behind, we can say कसैलाई पनि नछोड्नु. कसैलाई पनि means no one, and then नछोड्ने is don't leave them behind. And for nothing for us without us, we can say हामी बिना हाम्रो लागि केही पनि हुँदैन. I think, yeah, that's how it can be translated.
Okay, that's amazing. So we will, thank you so much for the effort. And we will propose the Hamrabaini team that in the material that they are developing to be used in the schools or whatever, have this sketchy phrase, right? So that they could use it. Great. So we have another small presentation, few slides. But before that, do you have any questions? I would like to hand over to Bikash again to have a few thoughts before we move on to the final session. And then we have a small breakout activity. Over to you, Bikash.
Please, anyone, any questions, concerns regarding inclusion? Nothing? Sorry, Novil, you are on mute. You are on mute.
Yeah, I'll unmute. Yeah. No, yes, sorry. I was just telling, okay, we'll move on to the final presentation and then we'll probably take up the questions later. Is that okay? Because I don't see any questions anymore. Okay, yeah, great. So now we bring all this to you, the Hamrabaini champions. And we are going to see what does all these things mean? What do all these things mean to you as adolescents? I think you all are adolescents, or at least youth. So adolescent sexual and reproductive health in emergencies. So in this brief session, you will be able to explain why it's important to recognize define the characteristics of adolescent-friendly health services, describe principles of meaningful participation of adolescents along the program cycle, be familiar with tools for ensuring adolescent participation in sexual and reproductive health programming in emergencies. So why adults are so important? There are probably 2 billion of the world population. AIDS is now the leading cause of death among young people aged 10 to 24 years in Africa. Every day in developing countries like us, 20,000 girls under the age 18 give birth. Remember, these are young girls under 18 years of age, they give birth. From 2009 to 2012, proposals for SRH through humanitarian funding streams constituted less than 3.5 of all health proposals. Most were unfunded. So SRH means adolescent sexual and reproductive health proposals were constituted only 3.5% of health proposals. That means when they looked at the proposals, only 3.5 were about adolescent and sexual and reproductive health. But most of them were also not funded. They were just proposals, right? So adolescent sexual and reproductive health are usually neglected area. Who are adolescents? Individuals aged between 10 to 19 years. Very young adolescents are 10 to 14. Middle adolescents are 15 to 16. And old adolescents are 17 to 19. It depends on the type of physical, behavioral, and psychosocial changes. They are very different. They are going through all these differences so fast, right? At 10 to 14, these end like 9 years, 10 years, it's a child. But if you take 19, 20, it's an adult. So somebody within the span of about 10 years become an adult from a child. This is a lot of change, right? And therefore, adolescents are heterogeneous group. Adolescent sexual and reproductive health in emergencies. Okay, adolescents do have sexual and reproductive health needs, but what about that in emergencies? What does sexual and reproductive health of adolescents happen to SRH after earthquake, flood, landslide? Just turn your eyes to Turkey and Syria. So how would the adolescents feeling about their sexual and reproductive health needs? Family, community, and social structures are often disrupted after emergencies. Formal and informal education discontinued. Fear, stress, boredom, and hopelessness are spreading. There are loss of role models. There are no more role models. There's increased risk behaviors and increased exposure to risk. So this creates a very dangerous situation for adolescents. Who are the adolescents at increased risk? There are pregnant adolescents who are pregnant, unaccompanied adolescents who don't have their adults to care for, marginalized adolescents, including adolescents living with HIV, adolescents with disabilities, adolescents who identify as LGBTQIA, adolescents belonging to indigenous or migrant groups, and adolescents engaged in exploitative behavior, exploitative labor. There's forced labor, who have been asked not to go to school but go and work, who has been abused, right? These are kind of adolescents who are at increased risk. So you all know about the social ecological model, right? So if you take the adolescents, so adolescent cannot behave in his own or in her own. Their family is around them. So decisions are all similarly is be so not only by also the community. And then text. The community very different influence on community, family, and adolescents, and often a very negative effect after disasters. So different factors influence the individual's ability to make decisions and access services. Therefore, the sexual and reproductive health rights and outcomes of adolescents can be very different in a disaster setting. So, adolescent sexual and reproductive health in humanitarian toolkit complement to interagency field manual and minimal initial service package implementation. It highlights principles of adolescent responsive health systems and meaningful engagement. So if you want to know how you could get adolescents, young girls and boys engaged in your work, especially after disaster situation, please go to this link and download the book and learn. And also you will be managing adolescent sexual and reproductive health awareness project. So you will become a project manager. So think about the ways that you go and get adolescents engaged. How do you get them participated in your work? So this SRH toolkit will be a very useful resource. So please go download it and study it and use it. So adolescent responsive health systems, usually our health systems are very good to cater to the children. You go to the hospital, you have pediatrics ward. You go to a medical ward or surgical ward, that caters to the adults. Even old people can go there. But you go to a hospital, do you find adolescent wards? Usually no, right? So if you want to progress towards universal health coverage, I hope you have heard about universal health coverage. It requires a transition from adolescent-friendly health services to adolescent-responsive health system, including humanitarian crisis. Health systems were initially thought as needed to be adolescent-friendly, but now we are saying, no, it should become adolescent-responsive. The ability of the health system to meet the population's legitimate expectations regarding the interaction with the health system, apart from expectations from improvements in health or wealth. So this is adolescent responsive health system. And this health responsive health system means health system that want what the people want from a health system in addition to increasing their health and wealth. For example, they want the health system to be respectful of the others. So these are some ways that we have to make sure that the health services are responsive. Adolescents face barriers to information and services. It can be due to individual barriers, social, cultural barriers, and structural barriers. Can you remember the social ecological model that we talk about? So adolescent is not isolated, right? So adolescents in the middle of all these things. So therefore, they will have these barriers. And then adolescent sexual and reproductive services must be acceptable, accessible, affordable, appropriate, and then equitable, effective, efficient. So if you have another question, what are the characteristics of adolescent sexual and reproductive health? You go and write 4 A's and 3 E's, you will probably pass. Okay, but you have to write what they are. Acceptable, accessible, affordable, appropriate, and equitable, effective, and efficient. So there are checklists that you can use like this to find whether a health facility is adolescent friendly, especially after disaster. if you go with your school or somebody else in your organization to provide health services, make sure that they are adolescent friendly. Okay, now we talk about disasters, emergencies, and all the bad things about disasters. But adolescents can be a very useful resource during disasters and emergencies. Adolescents can become a big asset. This program, Hamrabahini, is focusing adolescents. You all are adolescents, and you are going to empower more adolescents. These two groups can become a very powerful resource in emergencies. Why? Because adolescents are resilient. They can face whatever happens. When I listen to the amazing stories of young people from Sri Lanka, your country, and across the world, I get so inspired. I always want to be adolescent again. They're very resourceful. They know how to do things. They know how to get things done. And they're energetic. And also, you can get the meaningful participation in programming at all stages, in the planning and decision making. They can be used as educators. They could work in youth centers. They could operate youth centers, adolescent outreach, community outreach, linking SRH services. And oh my God, you can't see the slides? Somebody can't see the slides? I'm sorry, Yogesh. Yogesh, you can't see? I'm so sorry. Am I the only one not being able to see the slides, or everyone else's screen is also blank? I think there's a problem with your screen or something, Yogesh. Okay, don't worry. We are almost done, but I will share all these presentations. So maybe you can go through them later, and also you can go through the recording. Okay, so don't worry. We're just finishing. So you can get all these services, right? And then stakeholder involvement to build community trust and adult support. All these things can be done with the youth. So you can get them engaged in all stages, in the design and prepare phase, implementation phase, and review phase. So what can we do? We have to get youth engaged, adults engaged, but how do we get them engaged? What do we have to keep in mind? Policy for engaging volunteers under the age of 6. Usually they are not taking as legitimate parts of the society because you are not an adult. But adolescents can be engaged. We should have policy level changes for that. Orientation to your agency's way of working. The agency should have a way to get adolescent engaged. Usually they hire even people over 18 years of age, right? Because you can do a legal contract with an adult. Clear selection of criteria for adolescent and youth volunteers, communication terms of engagement for adolescents and youth volunteers. So here are some of those things that we have to think, but there can be many others and you can always think about those. Okay, these are the concluding thoughts about this presentation on adolescent and sexual and reproductive health. Adolescents face particular risks in humanitarian settings. It is vital to provide adolescent responsive SRH services in these settings. And adolescents bring particular strengths and capacities to SRH programming in emergencies. And it is critical that adolescents are engaged by SRH program managers through sincere and meaningful actions along the program cycle. So before I end, I would like to acknowledge the International Planned Parenthood Initiative. You can see their logo, IPPF here. So it's a network of organizations working on sexual and reproductive health. And these slides were prepared by me for the Family Planning Association of Sri Lanka, modifying the IPPF training slides to the Sri Lankan context. And with gratitude to FPA Sri Lanka and IPPF, International Planned Parenthood Federation, of which the Family Planning Association Nepal is also a member. So I acknowledge all of them in this moment for sharing this material, and with due respect to them, these presentations would be shared with you so that you could use in whatever the programs that you want to conduct. Please acknowledge the source when you are doing that. Yeah, so let's stop there. And Bikash, what about our timing? I think we are a little behind the time, or how are we going? We have to do a small activity.
We still have 20 more minutes.
We have about 25 minutes, right? 24 minutes, yeah. 10 minutes, yeah, 20. Okay, then we'll do very briefly in 10 minutes, and then we'll use the other 10 minutes for the debriefing. So I will explain the activity, and then I will get the support of Bikash to get the logistics and put you into a group discussion breakup rooms. Now we are coming into the fourth session. Let me share the slide. We are going to do an exercise. We're not going to do any presentations now. I'm not going to do, but you will discuss action planning. Okay. After this session, you will be able to use the knowledge obtained on sexual and reproductive health in emergencies, inclusion and adolescent engagement for preparedness, response and recovery planning for an earthquake. Okay. Share the strategies developed for preparedness, response, and recovery planning for an earthquake. But we are not talking about normal planning. We are not talking about how we should be prepared for earthquake, how we are doing response, how we are doing recovery. You know all that. But we want to know how you would use the sexual and reproductive health, inclusion, and adolescent activities in disasters, emergencies. So we will move into 3 groups. The first group would be group 1. They will be in preparedness. Group 2 would be response. Group 3 would be recovery. What strategies would you adopt for ensuring SRH services, inclusion, and adolescent engagement in each of the above stages of Nepal earthquake, 9.4 Nepal. I hope it will never happen again, but in case it happens, it's good for us to be prepared. So let me put that in the chat also, but when you go into the breakup rooms also, we'll put it here. So I will put that here in the chat. And to all of you, everyone in the meeting, and then Bikash will get ready to do and group 1, preparedness. Preparedness is before the disaster, right? Group 2 is during the response, when we are doing the response. And group 3 is recovery, right? Recovery. Right. Here you go. Okay, over to Bikash. So we'll go to the group for 10 minutes, and then we come back and we have a brief debrief. Okay, let's be very brief. Over to you, Bikash. We need 3 breakout rooms.
Bikash, you are doing that?
I was checking, but I didn't see the time.
Okay, okay, I will do it. Okay, just a minute.
Okay. I will put it on your chat as well. So you can put it to the groups after they break out. I sent it to Hamro Bahini chat to you. Direct message, okay.
They're back now.
Great.
Welcome back, everyone. I hope your discussion went pretty well. And now we will start sharing from each group, right?
Yes.
So from group 1, is anybody?
Hello everyone, this is Sukriti Shrestha and I am representing group 1. So our topic was preparedness. In preparing for disaster and covering up sexual and reproductive health services, the list of things we have prepared for services are giving training on preparing emergency kits yourself at home to teenagers and targeted groups. And that includes, and also stockpiling the emergency kits, which includes OCPs, sanitary products like pads and tampons, and also including, if there is a pregnant woman in a home, then they should keep a separate box for her only, for her safety and things we can use if necessary. And the other is providing education on what kind of services are available, and maybe making people aware about those things, especially the adolescent group of people, so they can circulate that information to their family members as well. And the other thing while discussing was decentralizing the the training sessions that we give, so that will help people not only in the urban areas but also in the rural areas. What can they do during the time of emergency? And another is providing training to healthcare workers as well as emergency volunteers on comprehensive SRH services. And another interesting thing we came up with was emergency shelter selection on local level. Like, there we will make a certain criteria, like what kind of toilet they have, what kind of water facilities they have, what kind of, how many people they can accommodate in case of emergencies. So it will be easier when people actually need to find they don't have to go, they don't have to roam around to find a safe space to live or survive during the time of emergency. And we can circulate that list to the public. And another thing was on legislation, we can pressurize the stakeholders to include the sexual and reproductive health services and rights in disaster management protocols that we have in our country. And the last one was creating a youth network and collaborating on local government level as well, and also involving multiple people from multiple sectors, so there can be idea sharing and people, and also from different part of the country, so they will know what kind of services that's available and also what can be done if there is lack of services. So that's all we discussed. Thank you.
Thank you. Thank you so much.
Thank you, Skriti. Well presented. Your group had a really nice discussion over there, and that we see here as well. Thank you for your presentation. And from group 2, who is going to present from? Okay, please.
Hi.
Go ahead.
Hello, everyone. This is me, Mili Koirala. So I'll be representing group 2, and the topic for group 2 was the response that we would do in a disaster like earthquake. So from our discussion, we came to a conclusion that the first response to a disaster would be managing the chaos. So it is necessary to include everyone. It is and making sure that nobody leaves behind, and everyone, every marginalized people, every gender, everyone gets the help and is getting facilitated by every help that is given to them, and equal number of tools and facilities are being available to them. for ensuring the sexual and reproductive health. There are certain things that we can do, like provide maternal kits, immediate delivery kits, menstrual products, and facilities for safe abortion in such chaotic situation, providing contraceptives, and making female-friendly, camps and adolescent-friendly services and adolescent-friendly camps. And for utilize for the adolescent groups, we can make adolescent friendly, we can give adolescent friendly services, and make sure that all the trauma and all the stress that they went through, and make sure that to bring them onto the track, and further using or mobilizing the adolescents to further manage the disaster and manage the chaos. So it would be a greater deal to, it would be a greater impact for and greater help to manage the chaos and manage the disaster. So this was some of the points that we discussed in the group for the immediate response to the disaster. Thank you.
Thank you, Mimi. This is 8 o'clock right now, and we will just we will do a last presentation, and if we can manage like for 5 minutes for any concern, then we will be here. So from group 3, who is ready to present?
So hi, I'm Kusvarai, and I'll be representing group 3. So our topic was the strategies that can be adopted for ensuring SRH services and for recovery purpose. And as an SRHR champion, what we will be doing when we are going through the recovery phase is, first of all, since among the various aspects of health, mental health is quite impacted during such kind of disasters. So as an SRHR champion, what we have learned, we will be implementing it in our community. So we'll be doing counseling, and we'll be providing them both emotional support so they can recover from those phases. And also we will be organizing a temporary health camp so we can provide the basic health services for them. And we will be reaching out to the community leaders, to the key focal person, so we'll be able to distinguish the people who are at vulnerable, who are at major threats, and so we can implement our program more successfully. And we will also be taking help of the media. So through media, we can provide helpline numbers so the people can access it when they are having certain difficulties. And also we have discussed that at such crisis situation, we will be providing nutritious food materials, and especially to the pregnant women and to the child, because they are more at potential threat. So for maintaining their health, we will be providing them nutritious fortified food. And for that purpose, we'll be collaborating with the local agencies or the organizations, and we'll be taking their help too. And those were the major things that we think will help in during the recovery phase. And that was it. Thank you.
Thank you, Khushbu. Yeah, after this presentation, I let me just add some more concerns of mine, and then we can forward. Yeah. Listening to the presentation here, I felt like this presentation could be more focused inclusion-wise, and I find it a little more need of more clarity on response and recovery. So maybe we will say it in a better way, I guess. That's all my concern here. And, while you discussed, like, it's already mentioned that it's a 9 point. Oh my God, sorry. Anobi, please. It's disturbing here. So if you have anything, please say it.
Yeah, I think we had a very good discussion, and you all have absorbed many of the important things. So we know that sexual and reproductive health is an important issue. That is the main thing, as Bikash mentioned. People talk about safety, food, water, toilets, medicine, but we forget that sexual and reproductive health is an issue. People continue to have sex even during disasters. Babies are born even during disasters. Girls and women and boys and men are being abused even during disasters. Unwanted pregnancies do occur. Abortions do occur during disasters. So the root causes of all these things are gender imbalance, disrespect for human rights, and abuse of power. So these root causes will continue even during disasters, emergencies, and crises. We have to be mindful and intentional about preventing them. So if you know that sexual and reproductive health is an important right, then you will do small things. These things are very small, like thinking about them, speaking about them, advocating for them. So we are very fortunate today. We have got these champions, the Hamrabahini champions, who would be empowered on this. And I have shared a lot of material. So you can read them for 5 months if you want, throughout the whole project, and learn more. And then when you go back to the community for the immersion, you will be able to practice them. And then when bad times comes, you will be the ambassadors of not only Hamra Bahini, but also of sexual and reproductive health. So that is my wish, and congratulations and good luck for all of you. Thanks again for giving me the opportunity to share some thoughts. And I hope and pray that we will be able to meet in person, and I can learn more words. I know then Makura is Makulua, and then I know a lot of very interesting, yummy foods, including momos. And I only know momo, but there are so many other things. And I hope we will be able to enjoy some food very soon. With that, thanks a lot, Amrabani team. Thank you so much, Bikash, for moderating this. Thank you, Prakriti, for the invitation. And so over to you, and hope to see you all soon. And there's a survey on the chat, right? The post survey. Yeah. And then if that's okay.
Thank you, Novil. Thank you so much.
Thank you so much.
It was really great. And thank you everyone for joining us until the end of the event. So I hope you will fill the response push survey form